For some who have recovered from COVID-19 symptoms, those symptoms continue to occur. One of them is pharozema, which can distort a sense of smell. Felicity Bosk tells us more about the condition and how doctors are working to treat it.
If you're at a bakery or a flower shop or a coffee shop, you're used to things smelling a certain way, but for people with parosmia, it can be like
breathing an ashtray all the time.
Dave Peliquin of Eau Claire says he lost his sense of smell when he had COVID-19 in October. After recovering, he began suffering from post-acute COVID-19 symptoms, also known as being a long hauler.
It's not fun, and it's hard to explain what your symptoms are, and every time you get an ache and pain, you wonder, is this COVID related or not?
One of those symptoms is a distorted sense of smell. Dr. Birkin Olgren at Prevea Family Medicine describes parosmia as a condition where there's a dysfunction with your ability to smell things properly, and usually things smell worse.
It's pretty common that if you do have a loss of smell after COVID, when the brain is trying to rewire those and regenerate those neurons and those pathways, it's a little bit of a trial and error situation going on, and it can sometimes screw those up. And so we end up having things smell very different than what they typically do for us.
Olgren says for some, this symptom goes away in days or weeks, others months, but that it eventually goes away on its own. Peliquin says he's been experiencing parosmia now for the past 2 months, but is hopeful he and others will bounce back.
Just, hang in there and know that there's other people out there that are with you.
Reporting for Eau Claire's own News 18, I'm Felicity Bosk.
Dr. Olgren says things like smelling essential oils can help some people recover faster, though as of now, there is no definitive cure for parosmia.